Madison Baker. I'm a PA student. Do you mind if I do a quick physical exam?
No, that's fine.
Okay. First, can you verify your name and date of birth for me?
Madeline Brownlee, 4597.
Okay, great. So first, I'm just going to start by taking your vitals. I'm going to take your temperature. This is an oral probe, so I'll just put it under your tongue and have you close. All right, 97.6, that's good. Next, I'm just going to take your heart rate, and while I'm doing that, I'm also going to be doing your respiratory rate. So I'll be doing that for 30 seconds. All right, so your heart rate was 60 beats per minute. Normal rate, rhythm, and strength was 2+. And your respiration rate was 14 breaths per minute. Normal rate, rhythm, effort, and pattern. Next, we will be doing your blood pressure. So I'll have you turn around this way for me. I'm just going to attach this. Okay. And then I'm going to feel for your brachial pulse. Okay. All right, so then I'm just going to pump up the cuff until I stop feeling your radial pulse. Okay. I'll let your arm relax a little bit. And then I'll actually hold your arm like this so you're relaxed. All right, 102/72, that's good. All right, great. So now I'll have you face me again. And we're gonna move on to me just asking you a few questions. So do you currently know your name?
Madeline Brownlee.
And where are you right now?
At the doctor's office.
All right, and what is the date?
It is Tuesday, August 25th.
Okay, great. So you are alert and oriented ×3 to person, place, and time. Now I will just kind of take a look at you. You appear to have good hygiene, normal eye contact, good speech, nourishment is appropriate, and your affect is appropriate as well. Now we're going to move on to the eye exam. So first I'm just going to do confrontation by visual field. So I'll have you cover your eye with one hand. And whenever you see my fingers wiggle in your visual field, tell me when, okay?
No. 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 No.
Okay, now do the other eye. And same thing.
No. 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 No.
Okay, great. Now I'm going to be testing your light reflex of your pupils. So I'm just going to shine this light in your eye and you can just relax. Okay. Pupils were equal in size, round, and reactive to light, and then normal, consensual, and direct light response. So now I'm going to be making an H with my finger. So you're just going to follow my finger with your eyes. Don't move your head. And then at the end, I'll be going towards your nose, okay? Okay, good. All right, so next we're going to move on to the ear exam. So I'm just going to, okay, so I'm just going to first just look at your ear. So I'm just gonna take a look here. And then on the other side. Okay, good. So no drainage or lesions. I don't see any like masses or anything like that. When I do this, do you have any tenderness?
No.
What about on this side?
No.
Okay, great. So first I'm just gonna look in your ear really quickly here. Okay, good. Now I'm gonna go to the other side. Okay, good. So your TMs were normal, pearly gray. I didn't see any discharge, and you had normal light reflex on both sides. So next I'm gonna look at your nose. Your septum appears midline. I don't see any drainage. And now I'm going to just look up there. If you feel uncomfortable at any moment, just tell me. So I'm gonna put my hands on your forehead, and then I'll just kind of lift up. Okay, good. Okay, good. So your turbinates, the inferior and middle were visible and normal, and the mucosa was normal with no dryness or discharge. So now we are going to be doing the mouth. So I'm just going to take a look here. I'll turn my light first. Okay. Oropharynx is normal, dentition appears normal, and teeth are correct number and size and shape. Okay, so now I would elicit the gag reflex. I'm not going to do that today, but we would do that. And then I'll have you say ah, ah. Okay, so symmetric elevation of the soft palate, and then I'll have you stick your tongue at me. All right, so midline protrusion of the tongue, that's good. All right, so next is going to be the neck, and I'm going to have you turn around in your chair, and I am just going to look. Your trachea appears midline. Now I'm going to actually come behind you, and my hands are a little cold, but I'm just going to pull, and then I'll have you swallow. Okay, good. Normal symmetry, size, shape, and did you have any tenderness when I did that?
No.
Okay, so no tenderness. Now I'm going to be listening for carotid bruits. So I'm just going to go to one side, and when I do this, I'll actually have you hold your breath.
Okay.
So I'll tell you when to hold your breath, and then I'll tell you when you can breathe again. And I'll be doing this with the bell. So go ahead and hold your breath. Okay, you can breathe. And then we'll do it on the other side. Okay, go ahead and hold your breath. Okay, and you can breathe again. All right, so no presence of bruits in the carotid. And next I'm just going to be feeling your lymph nodes. So if you want to turn this way for me, and then I'm just going to feel preauricular, postauricular, occipital, tonsillar, submandibular, submental, and then anterior cervical, posterior cervical, and then I'm going to do your supraclavicular. So do you mind if I pull your shirt a little bit? Okay, good. And I didn't feel any abnormalities. It all felt good. Did you have any tenderness there?
No.
Okay, so no tenderness. So next I'm going to be doing your upper extremities. So I'm just going to take a look at first and feel your skin. So no rashes or lesions, no erythema or edema, normal temperature. So everything looks good there. And then I'm gonna do some tests on your strength. So I'll have you put your arms out like this, and I want you to resist me pushing down. And then you're gonna try to push up, and I'm gonna try to pull you down. And then I'll have you go like this with your elbows, and I'm gonna try to pull you down. And then you go the other way, and then I'll try to. Okay, great. And then after that, we'll do your wrists. So I'll have you go like this, and I'm gonna try to pull you, and then do it the other way, and then I'll try to pull you. Okay, good. Next, I'm gonna feel your radial pulses. So I'll just put my hands right here, bilaterally. Okay, good. Good, 2+ strength there. And then next, I'm just going to do your capillary refill. So I'll just push on your fingers. Okay, good. That's normal as well. And then we're going to move to the lower extremity. So I'm just going to look, feel. I don't see any rashes or lesions. Your temperature is normal, no erythema or edema. And then I'm going to do your pulses. So I'll just do dorsalis pedis bilaterally. And then posterior tibial bilaterally. Okay, good. And now we're gonna test your lower extremity strength. So when I push on your thigh, you're gonna try to push up against my resistance. And then I'm gonna put my hand underneath and have you push down. Okay, good. Now same on the other side. Okay, good. And then try to push down. Good. And now I'm just gonna move the camera a little bit so we can see. Okay, so now I'm gonna do the same thing with your knee. So I'll have you try to push your feet out towards me, and I'm gonna try to push against you. Okay, good. And then try to kick your heels towards the chair, and I'm gonna try to pull. Okay, good. And then the same with your feet. I'll have you try to push your feet towards the ceiling, and I'll resist, and then try to point your feet down. Resist. And then on the same side. Good. And then the other way. Good. Okay, great. So next we're gonna move on to the heart exam. I'm just gonna listen, so I'll have you take your shirt off and yeah. Okay. All right, so I'm just gonna listen, and then do you mind if I like displace your bra a little bit? Okay. And then do you mind displacing your wrist just like a little bit? Great. Okay. And then I'll just let you. Okay, good. All right, S1 and S2 were normal. I didn't hear any murmurs, gallops, or rubs, so that's great. And next, I'll just have you turn around. And we're gonna do some lung sounds now. So what I'll have you do is cross your hands on your shoulders, and then I'm going to just do, once I move my stethoscope, I'll have you take a deep breath in through your mouth. Good. So I didn't hear any wheezes, rhonchi, or ralls when I did that, so that's all normal. So next we're going to do the abdominal exam. So I'll have you go over to the patient bed and lay down. And so first I'll just auscultate. So I'm just going to listen in each quadrant. All right. Okay, good. No hyper or hypoactive bowel sounds, and it sounded normal. So next I'll listen to your abdominal aorta. And then the renal arteries. Okay, good. No presence of Brui there. So now I'll just be palpating. Before I start, do you have any tenderness anywhere?
No.
Okay, good. So first I'll just start with a light palpation. Okay, and now I'll do a deeper palpation. Okay, good. Any tenderness when I did that?
No.
Okay, great. So we're all done there. You can get up and put your shirt back on. Alright, so now we're going to just move on to some coordination and neuro stuff. So I'm going to first just test your reflexes. So I'll have you just relax your arm, put it this way, and then I'm just gonna hold here. Okay, good. And then on the other side. Okay, good. So biceps, tendons were reflexive, and now I'm just gonna do the patellar, so just relax your legs. That's very good. Okay, so after that, I'll have you stand up for me, and I'm gonna have you walk like you're on a tightrope, okay? All right, good. All right, good. So gait appears normal, and now I'll have you stay standing up, and I'm gonna have you, I'm gonna move my finger, and as I move it, you're gonna touch your nose and then touch my finger, okay? Good. And then I'm gonna move it, not touch my own nose. Okay, good. Now we're gonna do Romberg test. So I'll just have you stand with your feet together and close your eyes for me, and I would be doing this for 30 seconds. All right, it's been 30 seconds and the patient didn't sway or fall, so that's great. Next, I'll have you stand like that, but I'll have you put your arms out like this, and then I'll have you close your eyes, and I would do this for 30 seconds as well. And then once I knew the patient was stable, I can push down a little bit and see if she wavers, and she does not, so that's great. All right, so that's good. Next, I'll have you sit down. And I will have you, I will be doing cranial nerve 5. So I will just be pushing this, I'll have you close your eyes, and then I'll be pushing this on your face in a light touch. Raise your hand for which side it's on, and then tell me if it's on your forehead, your cheek, or your chin, okay?
Okay. Cheek. Forehead. Chin. Cheek. Forehead.
All right, that's good. And then next I will be testing cranial nerve 8. So I will, actually just kidding, before we do that, let's do cranial nerve 7. And I'll have you smile for me, frown, puff your cheeks out, and then raise your eyebrows. And then close your eyes, and I'm gonna try to pull them apart. Okay, good. All right, so now I'm gonna be testing cranial nerve 8. So I'll be going behind you, and I'm gonna do what we call the whisper or finger rub test. So I'll be doing it on one of your ears. I'll have you close your eyes, and then raise your hand for which side you feel it on. Okay, good. So that's done. And now we are going to be doing, let me just think for a second here. Let's do cranial nerve 11. So I'm just going to have you, I'm going to push my hand on your head, and you're going to try to look this way, and I'm going to try to resist you. Okay, good. And then we'll do the other side. Good. And then the same thing with your shoulders. I'll have you try to shrug your shoulders, and I'll push them down. Okay, great. And then we would also do a genital urinary exam, but we're not going to do that today. And let me just think if I've forgotten anything. I think we're good. All right. Thank you.
Thank you.